There are currently no articles in the scientific published literature about hydroimplantation of a three-piece lens. That's amazing that everything that's ever been written on this technique, hydroimplantation, specifies a one-piece lens. And the only articles that deign to mention the possibility of a three-piece lens say specifically not to do it. And it's not clear why. It may be because at the time that these articles were written, the three-piece lenses, they had that screw injector system, and that screw injector is a two-handed manipulation, and then to hold the eye in hydroimplantation, it's just too fuddly. But more likely it's because of some concern that the three-piece lens would scratch or pop the capsule or tear or create some damage inside of the eye, and the soft, pliable nature of the one-piece lens wouldn't lend to that complication. That's an interesting theory, but it's a bummer because number one, hydroimplantation is a great technique. It's a very fast, economical, efficient way to deliver a lens into the eye without having to fumble putting viscoelastic in and then remove all of the viscoelastic afterwards. So it's a way to streamline the operation. And number two, three-piece lenses are great technologies. I prefer a three-piece lens as my standard default IOL for basically all cataract surgeries. Specifically, I like the silicone three-piece, the LI61AO made by B&L, and we have no financial interest, but I love this lens because it's so versatile, having a three-piece lens ready to go that's preloaded. So it's easy and convenient to use in a tricky case or in an easy case. So we thought a few months ago to test this hypothesis that hydroimplantation cannot be performed with a three-piece lens. And the results of these testing have been that over these past few months, this is the way we have done all of our cataract surgery. All of our cases have been hydroimplantation with a three-piece lens, and it's become our preferred technique. So it's not only possible, but I think it's better, and I want to show you some video clips to demonstrate why. These are three cases done today. Here's an eye that's just had cataract extraction with cortex removal. I've got an irrigating port in the eye, and I'm injecting this lens through my push plunger mechanism. It unfolds beautifully inside of the eye, and you can tuck the leading and trailing haptic with the plunger, and that's it. It's in and done. Here's another case. It's a similar concept, but a little bit of a smaller pupil. Visibility is reduced. It's no problem. The leading haptic goes directly into the capsular fornix, and it's easy to tuck the trailing haptic in a similar way. Here's a third case. Now, this is a floppy iris patient. You'll notice that the iris is already misbehaving out through the paracentesis. It doesn't matter. We inflate the eye with this irrigating handpiece. We inject the lens into the capsular bag. The trailing haptic goes in as well. You have a little iris prolapse here, but that would occur anyway, whether you're using viscoelastic or BSS to keep the eye stable. So these are just a small snapshot of the cases that we did today using this trick. And the reason that we like it so much is because it makes the case much more efficient. So rather than having to open viscoelastic and then put it in the capsular bag and then fuddle with the lens and then remove the viscoelastic, it eliminates all of those steps. So it makes the operation much quicker. That's better for the patient, not to have to lie on the operating room table so long. It's also better for the flow of the clinic. It's just a better experience. It's safer when the surgeries are quicker as opposed to drawn out over a longer period of time. It's also manifestly safe. There's no point where we ever have felt over these past months like there was any risk of damage or danger to the capsule. The lens is cushioned inside of the eye by this flow of BSS just exactly in a normal, safe way. It doesn't seem at all like there's any risk of tearing the capsule. So since we have switched to this manner of delivering the lens inside of the eye, it's made the operation much faster for us, much more enjoyable for the patients, and it's certainly possible. I think these videos demonstrate conclusively that the published literature is wrong, that hydroimplantation can be done for a three-piece lens, and that's important because three-piece lenses are a great lens to use for your normal, standard, routine cases, not just your exotic cases, but the everyday cases. And the ones that come preloaded with the push plunger injector are so easy to hydroimplant using a bimanual irrigator to hold the eye, to inflate the chamber, and to keep control while you drive the lens into the eye using the push plunger injector of the one-handed delivery systems. So we've been super happy to incorporate this into our practice. Whether you decide to do it or not, if you're already doing hydroimplantation, you may think about adding this to the possibilities that you offer because it is most certainly safe and possible. Thanks for watching.